Hello, good afternoon. I'm Dr. Zaza from Tampa, Florida, United States, Everglades University. Um, I'm a faculty member for Everglades University and a full-time physician in Tampa, Florida. I want to thank you all for inviting me to this conference, and I'm very happy to share this presentation. This paper was published in Nutritional Perspectives, the journal for the Council of Clinical Nutrition. I believe it was the October edition. It's found in my ResearchGate profile. So if anyone wants a copy, I can definitely provide the copy. And of course, if you have any questions about the paper and the presentation, feel free to let me know. So as when it gets started, I don't want to waste too much time, just to jump into matters. Presentations on vitamin D. I had vitamin D and asthma, of course, childhood and adult asthma. I had written a paper a few years ago about magnesium and asthma, right? Intravenous magnesium. And the interesting thing about that in the past was that the proposed mechanism was bronchodilation, right? It competes with calcium and induces bronchodilation. And, it was somewhat effective for a severe exacerbation of asthma, right? That being said, although asthma has bronchoconstriction as one of the main features, is we need to definitely divide it. So let's go into the first slide here. Epidemiology, right? So here's what I was talking about. We need to classify asthma into allergic and non-allergic, right? Although there's a bronchoconstriction component, right? We need to classify it, right? We need to know exactly what type of asthma we're dealing with. If it's allergic asthma, allergy testing would be appropriate. And if it's non-allergic asthma, then we still use the bronchodilators. But the one that I'm focused on in this presentation is this one, right? The allergic asthma, because that implies that there's an immune system component to that allergic asthma. So instead of giving a bronchodilator, right, or in the case of my previous paper, the intravenous magnesium as a natural bronchodilator, right? Is there anything we can do nutritionally to boost our immune system and improve perhaps the allergic asthma? Right? So that's the question I'm trying to answer. So in terms of stats here, 5 to 10% of the US has asthma, more common in black and whites. And it's increasing in the last 20 years, which makes this topic very relevant. And here's a classification: allergic, which is what I'm going to concentrate on, and non-allergic. Even the standard treatment with bronchodilators, right? Kind of fails to really address the immune system, right? It's not boosting the immune system by any means. Yet we're talking about allergic asthma, right? So standard treatment is a bronchodilator, but the immune system is the same, right? We haven't improved the immune system in order to probably minimize the symptoms. So this presentation saying, well, can vitamin D boost the immune system and minimize, right, the exacerbation of asthma? Let's move on. Types of asthma, this was big. So allergic is what we're focusing on here. There's non-allergic, of course, right? So it could be due to virus, cold air, physical activity, reflux disease, sinusitis, right? Some medications. But this one's the one I'm focusing on, right? Environmental allergens, dust mite, domestic animals, all these triggering an immune response, right? So allergic asthma is the focus of this presentation, and therefore the immune system, right? What is happening to the immune system? Is it maybe, and I don't want to get into the immune system too much, but does our immune system fluctuate? Does the production of cortisol suppress the immune system? And as we know, cortisol varies throughout the day, right? And depending on certain situations, it may peak, it may increase more than normal. In those moments when it increases more than normal, would that suppress the immune system and make it vulnerable to an asthma attack, right? So if suppressing the immune system makes the patient vulnerable to an asthma attack, would boosting the immune system make these attacks less likely or minimize the aggravation or exacerbation? Right? So let's move on to the next one. This has to do with the diagnosis, which probably won't get into too much, right? I think peak flow meters is what we do the most in a doctor's office because it's the easier one to do. Then if they require more advanced tests, then that is done as well. But peak flow meter would probably be the first one. As you all know, along with a thorough medical examination, right? Auscultation of lung sounds, wheezing, right? All that can give us some information to eventually order these more advanced tests and arrive to the diagnosis of asthma. I did mention something earlier, which was perhaps doing allergy testing for patients who have allergic asthma, right? And all that's fine. Avoiding exposure to the allergens is definitely part of the treatment. Absolutely. A bronchodilator may be used for rescue breathing or if there's an acute asthma exacerbation. Right? But the main topic here is there something we can do to boost the immune system? All right, so let me see. So we did that. Let's move on to this. So asthma and COPD, although asthma is a type of COPD, right? But basically, if we compare asthma and emphysema as an example, we're going to find some differences, right? So here it is, the age, right? Childhood and over 40, allergic, non-allergic compared to cigarette consumption, in the case of emphysema mainly, episodic acute exacerbations, and this one chronically progresses. This asthma may be reversible, the bronchial obstruction, the COPD would be persistent. And the medication, right? Long-term inhaled corticosteroids to bring down the inflammation. May sound like a paradox, but yes, the inhaled corticosteroids may actually suppress the immune system, which is not very good if we're talking about allergic asthma, but it does break down the inflammation. And COPD, we're looking at the muscarinic antagonist, right? The LAMA is basically the long-acting muscarinic antagonist, right? To basically induce bronchodilation. All right, let's move on. All right, so classification of asthma, the most severe category, right? Intermittent asthma, we have mild persistent asthma, right? And moderate asthma. Then here's talking about how much do we use a short acting beta agonist, right? So bronchodilator, beta 2 agonist or bronchodilator. So it classifies them and it talks about the lung functions of each. How do we classify the asthma? So we need to quantify this, and of course, it has to be based on lung function, right? Again, all this is fine, but we need to now shift towards the immune system component, right? Bronchodilators, whether it's a beta agonist or a muscarinic antagonist, which both bronchodilate, we need to evaluate if there's a way of boosting the immune system and perhaps minimizing the aggravation, which is what I want to answer here in this presentation. So let's move on. So this is what I found, right? So I have 2 studies here. So I broke them down, one in 2015, one in 2022. One was a systematic review meta-analysis by Riverin et al. And Liu, which was a meta-analysis, right? 8 randomized controlled trials for Riverin, 10 randomized controlled trials for Liu, right? Number of patients, 573. Number of patients for Liu, 1,349. All right, so what did each one found, right? So Riverin found that vitamin D supplementation may reduce asthma exacerbation according to small, low-quality randomized controlled trials. So here we're talking about children, right? So vitamin D may reduce, right, asthma exacerbations in children, right? So we do have evidence of that here with Riverin, 8 randomized controlled trials, 573. Basically emerging evidence, but nonetheless, it's still evidence, right? We need to boost the immune system. I mean, there's no way around it, right? Allergic asthma, yes, it's triggered by an allergen and we have to avoid exposure to it. But at the same time, the immune system may be suppressed due to certain factors. We need to find a way to boost the immune system. What can we do naturally? What can we do in terms of supplementation? Well, according to Riverin, vitamin D may actually reduce asthma exacerbation in children. Now let's go to Liu. Children with asthma can experience fewer exacerbations if they take vitamin D supplementation for 6 months following treatment. So, I mean, in addition to the inhaled corticosteroids, right? Which again, remember, we talked about this, it's actually going to suppress the immune system further. In the case of allergic asthma, right? Decrease the inflammation. Of course, we have those short-acting bronchodilators depending on the severity of the asthma. But this presentation, or at least these 2 studies, are saying we can also supplement with vitamin D, right? To boost the immune system and minimize the exacerbation. Right, so adults now, right? So here we have 3 studies, right? Joliffe, which is a systematic review meta-analysis, Wang, which is a meta-analysis, and Shen, which is a systematic review and meta-analysis. All pretty recent, 2017, 2019, 2021. And they all used randomized controlled trials for all 3 of these studies, right? Joliffe used 7 randomized controlled trials, Wang used 14 randomized controlled trials, and Shen used 12 randomized controlled trials, right? 955 patients for Joliffe. 955 patients for Joliffe, 1,421 patients for Wang, and 1,543 patients for Shen, right? They're all evaluating as exacerbation. So let's go to the results. Jolliffe, supplementation with vitamin D reduced the need for systemic corticosteroid treatment for asthma exacerbations. This was even more interesting than the two studies for children, right? Because not only did this study by Jolliffe talk about asthma exacerbation, but it also talked about, does it reduce the intake of inhaled corticosteroids? And the answer is yes. It reduced the need for corticosteroid treatment, which is good, right? There's several side effects which we're all aware of. One is immunosuppression, but the list goes on, from affecting bone mass density to increasing glucose, and the list goes on. This vitamin D may help reduce the intake of corticosteroids, and therefore that is very positive, right? You don't want to give a child or an adult tons of inhaled corticosteroids, right? Here we have Wang, especially in patients with vitamin D deficiency, vitamin D supplementation reduced asthma exacerbation. Measuring vitamin D is not that common. I think I had my vitamin D levels measured, but if it comes to an allergic asthma patient, I would probably measure the vitamin D levels because, it's in the best interest of this patient to reduce the amount of corticosteroids, to measure that vitamin D level and perhaps supplement with vitamin D, right? So especially in patients with vitamin D deficiency, vitamin D supplementation reduced asthma exacerbation, right? So that's Wang. And that was based on 14 randomized controlled trials, 1,421 patients. Last one, but not least, Shen. The rate of asthma exacerbation was safely reduced with vitamin D supplementation. So also reduced, and that was based out of 12 randomized controlled trials, 1,543 patients. Of course, the study I liked here the most was Jolliffe, right? Not only did vitamin D reduce asthma exacerbation, but it reduced the intake of inhaled corticosteroids, right? So we had 2 big studies for children, 3 studies for adults. So they're definitely merging research. There's more studies to come, right? But there is evidence, which I displayed today in this presentation, that vitamin D may help reduce acute asthma exacerbation and the intake of inhaled corticosteroids. All right, here's the conclusion. Based on these studies, it seems beneficial to measure vitamin D levels on pregnant women with a past medical history of asthma. Absolutely, right? Moreover, pregnant women with vitamin D deficiency should be supplemented with vitamin D accordingly to reduce the risk of the newborn child of developing asthma. Right? So that was based on studies I talk about in the paper, right? Where moms who supplement with vitamin D during pregnancy had a lower percentage of children actually developing asthma. Children with asthma should also be screened for vitamin D levels and receive vitamin D supplementation to reduce asthma exacerbation. Finally, adults with asthma should have their vitamin D level measured and supplemented accordingly if needed. So this presentation is encouraging the measuring of vitamin D levels in patients with allergic asthma. And it's also encouraging the supplementation of vitamin D in patients with allergic asthma as well, which can both decrease the acute asthma exacerbation, as we mentioned previously, and reduce the intake of inhaled corticosteroids. So there is evidence, and in addition to doing the allergy testing and avoiding the exposure to the allergens, I would definitely measure the vitamin D levels and supplement uh, with vitamin D for these patients with allergic asthma. All right, that was the last slide. I want to thank you all for listening and inviting me to the conference. I'm open to questions. If you want to have access to the article itself, please let me know through ResearchGate. I can share that publication with you. And it was a great honor. Thank you all.